Welcome back to Focus on Health. In case you're joining us right now, our topic today is cancer. And with me on set is Daktari from HCG CCK Cancer Center talking about cancer. Welcome, Daktari, to Focus on Health. So, Daktari, even before we head on to our topic today, kindly introduce yourself to our viewers.
I am Dr. Timothy Olubayo. I am a medical officer. I work in the oncology department. Mostly dealing with cancer patients, managing them, following up, and ensuring that they are coping up well and they are being given quality care to ensure that they are okay with their treatment.
Daktari, so let's head straight down to cancer. What is cancer? Rather, how would you define it in the layman's language?
Okay, so cancer is just a group of diseases that come about due to abnormal cellular growth. And the unique thing about cancer is that the difference between cancer and other diseases is that this disease has potential to spread to other parts of the body, other organs of the body, what we call metastasis.
Is there a specific cause for cancer?
I would say there is no specific cause for cancer. What we have, what we call risk factors. From the studies, it has been postulated that there are some other things that can predispose someone to cancer. So that those are what we call risk factors. And an interplay of these very many risk factors like cigarette smoking, some lifestyle things, e.g. obesity, genetic predisposition, when they come together is when they can predispose someone to having cancer.
Daktari, so if I'm a patient, I come to you and I think that I may have cancer, how do you now go about the diagnosis?
First of all, we have to ascertain why the patient thinks that they have cancer. So basically you have to take what we call in the medical field history. Understanding history is just basically from her patient's own view, him or her describing what she's been experiencing, correlating it with your medical knowledge, then go ahead to do examination, physical exam. Then that is generally just trying to elicit anything that you can get from the patient that is related to the disease, and then you go ahead and do some tests, what you call investigations, that will help you now clarify that this patient has cancer.
Daktari, is it possible to determine the particular stage of cancer that one has developed, or rather, how do you go about it?
For staging, you have to correlate. Different cancers are staged differently, but basically, in summary, just for staging, you have to correlate physical findings, investigations, and imaging. Investigation, mostly imaging.
Daktari, once one is already diagnosed and you've developed a particular type of cancer, how do you go about the treatment? Rather, what treatment methods do you use?
Treatment methods for different cancers also vary, but the common ones that we have in our place and within our country are like radiotherapy, chemotherapy, immunotherapy. Yeah. So radiotherapy is basically using X-rays. There is a machine that is used to deliver a specific dose they use basically X-rays to irradiate the affected place, or to irradiate the tumor or the cancer and that basically helps in killing the cancer cells. That is radiotherapy. And then chemotherapy, we use chemotoxic agents. Chemotoxic, like medications or agents that have ability to kill the cancer cells. Yeah, so we direct them, we give them to cancer patients, and they target the cancer cells and they help in killing the cancer cells. Yes, basically that.
Dr. Even as you wonder, tell us, what advice would you give to someone who is living with cancer? How do they cope and manage with that?
If at all someone has already been diagnosed with cancer, the best thing would be for this particular person to adhere to the advice of the primary health caregiver, the oncologist or the physician who is taking care of this patient, and that would include adherence to treatment. Yeah, because most of the cases we have in our place is progression of disease because people are not adhering to treatment. So they adhere to treatment. If at all somebody has been put on a regimen, let's say he has to finish these cycles of chemotherapy and then she has to undergo these sessions of chemotherapy, this patient has to adhere strictly and to ensure that he completes the treatment that has been given. Another thing is just good nutritional support. So this person has to practice a healthy lifestyle, and that entails good nutrition, exercise, keeping an active lifestyle if this person can, and then just being psychologically well. And you know, being psychologically well is contributed by very many factors. A good environment around the patient being mentally strong, because that also helps and contributes to the healing process.
Shall I give us your last remarks about cancer? Maybe what attitude should we have even as a society, as maybe a patient living with cancer? What would you tell them?
To the viewers, cancer is just one of the many lifestyle diseases like hypertension, diabetes, diseases that people live with for a long time. If at all cancer is diagnosed early, there is chances of somebody being declared cancer-free. But most of what we are having in our country currently is late diagnosis. So what we can be able to do as doctors is just controlling, ensuring that the aggressiveness of this disease is controlled. And so then it now becomes a lifestyle disease. So for that case, then people just need to understand that cancer is not a death sentence, that people can live with this disease, that is, if at all it's well controlled, then they can have good quality of life. Basically that.
Thank you very much, Dr. for joining us. It's been a pleasure and it's been a very informative session. We have come to the end of our session today, and there you have it from Dr. Cancer is not a death sentence. I've been your host, Bori Michelle. Until next time, stay safe and stay healthy. I will leave you with the healthier segment.